Understanding ADHD tests and assessments. Attention deficit hyperactivity disorder, ADHD, is a neurological development disorder that can affect individuals of all ages, from children to adults. Diagnosing ADHD is a crucial step towards understanding and managing this condition. In this blog post, we will explore the various tests and assessments used in the evaluation of ADHD, shedding light on the diagnostic process and its importance in providing effective support and treatment. Diagnosing ADHD often begins with a thorough clinical evaluation by a qualified healthcare provider. This evaluation may include detailed medical history. The healthcare provider will gather information about the individual's medical and family history, as well as any pre-existing conditions or factors that can contribute to ADHD-like symptoms. The healthcare provider may observe the individual's behavior, paying particular attention to signs of inattention, hyperactivity, and impulsivity. The evaluation is typically guided by the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which sets the standards for diagnosing ADHD. Rating scales are questionnaires that assess ADHD symptoms and their impact on an individual's daily life. These scales are typically filled out by parents, caregivers, teachers, and the individuals themselves. Common ADHD rating schedules include the Conners rating scales, the Vanderbilt assessment scales, and the Adult ADHD self-report scale. Continuous performance tests are computer-based assessments that measure an individual's attention and impulse control. These tests require the person to respond to specific stimuli while ignoring distractions. The results can provide valuable information about an individual's ability to sustain attention over time. Neuropsychological tests assess various cognitive functions, including memory, attention, and executive functioning. These tests can help identify specific cognitive deficits associated with ADHD and rule out other conditions that may present with similar symptoms. Psychological assessments, often conducted by clinical psychologists, can be part of the evaluation process. They may involve a battery of tests and interviews to understand an individual's emotional and psychological well-being. These assessments help determine the impact of ADHD on an individual's mental health and overall functioning. While not typically used for routine ADHD diagnosis, medical and neuroimaging tests may be recommended to rule out other medical conditions. These tests can include blood tests, electroencephalograms or EEGs, and brain scans such as magnetic resonance imaging. Diagnosing ADHD is also a process of exclusion, where other medical, psychiatric, or behavioral conditions with similar symptoms are ruled out. This ensures that the diagnosis is accurate and that the right treatment is provided. Diagnosing ADHD is a comprehensive process that relies on various assessments, observations, and evaluations. It is important to approach the diagnosis with patience and a collaborative effort between healthcare providers, teachers, caregivers, and the individuals themselves. Once diagnosed, it's crucial to remember that ADHD is a manageable condition and there are numerous treatment options available, including medication, behavioral therapies, and support systems. A thorough assessment sets the foundation for a personalized treatment plan that can help individuals with ADHD thrive and reach their full potential. If you suspect that you or someone you know may have ADHD, seek the guidance of a qualified healthcare provider to begin the assessment and diagnostic process.